Pattern recognition actually uses many of the similar features of forward thinking, but gets to an even more precise problem representation. Rather than using the branch chain algorithm to arrive at a syndrome, the problem representation uses that branch chain algorithm to arrive at a conclusive disease. And as I mentioned earlier, this really happens instantaneously or near instantaneously, that I recognize as an expert diagnostician that all elements of a disease that I know about are present. Essentially, this is rapid and externally invisible forward thinking. I don't take the time to sort of explain to you that I'm thinking, oh, this is acute versus chronic, oligo versus mono, with rash versus without rash. It's just clearly apparent to me that this person has disseminated gonococcal infection. And the key skills needed are the ability to process and develop problem representations, as we've been talking about, and a keen knowledge and understanding of disease illness scripts, and the ability to compare and contrast between diseases that might present similarly. So what you've seen here is I've kind of grayed out all of these other elements, because in pattern recognition, I very quickly arrive at this as the right answer, disseminated gonococcal infection. But intellectually in my head, this is the process that's gone on. This information about how experts use forward thinking and pattern recognition solves this clinical problem-solving paradox, because what we see is the experts are not collecting data indiscriminately. They're not doing a comprehensive history and physical. They've learned over time what features are going to allow them to navigate those either-or nodes in the forward-thinking pathway. And that allows them to decrease the amount of data they gather, but focus more on important data and increase the diagnostic accuracy. So I could actually change the titles of these lines here, and this would be forward thinking and pattern recognition. As expertise develops, we use more of that. And this would be hypothesis testing. And as we develop expertise, we use less of that. And that explains that paradox that we get better even though we get more efficient. Now, I do want to make a comment, and that is that even experts will use hypothesis testing at some time. They generally spend most of their time in forward thinking and pattern recognition. In fact, expertise is actually defined by the percent of time that an expert spends in pattern recognition and schematic control. But when problems are vexations, when patients don't get well, when there's new disease states that appear that haven't been seen before, or when an expert confronts a problem that they've never recognized or had the experience with, they will revert to the same hypothesis testing that a novice does. And so it's essential that we have an understanding and ability to use each of these for the particular situation in which we find ourselves with our patients. So, quiz 2.4. Compared with hypothesis testing, forward thinking, number 1, takes more time. Number 2, constructs a syndrome for problem representation. Or number 3, ignores all but one of patient's symptoms. The answer, number 2, constructs a syndrome for problem representation by collecting precise elements from the patient's history and physical that enable them to engage in compare and contrast thinking. So key take-home points. Clinicians use a spectrum of decision-making tools: hypothesis testing, forward thinking, and pattern recognition. Experts predominantly, but not exclusively, use forward thinking and pattern recognition as their preferred modes of clinical problem solving. They are both more efficient and more accurate, and can be expected to result in better diagnoses more quickly. Processing, or translating the patient's complaints into medical language, is the building block for problem solving. And forward thinking and pattern recognition rely importantly on carefully constructed problem representations. Next week, we're going to use these skills to create patient illness scripts and use those illness scripts to help prioritize differential diagnoses. And then understand how those prioritized differential diagnoses help us with the interpretation of the tests we choose to use to confirm or refute our patient's diagnoses. Please remember to check the homework on the website and keep your notes updated so that we can move forward with our patients.